Ibe Jikeme just brought in his sick child. He's relieved that he doesn't need to travel miles to get to the nearest hospital because his community has started putting a new primary health care center to use.
We carry the patient on our back to FMC, there. But as of now, we immediately, if any patients will rush in, it is nearer to us. So it is better than before.
The Azueke Community Primary Health Care Center provides delivery, antenatal, health education, and nutrition services. It has 9 female nurses, including Iwundu Ihuako, the principal nursing officer, who has spent 2 months here. She has been a midwife for over 10 years and puts that experience to good use as she makes her rounds and takes a look at Ibe's child.
Before you can be able to wait for a vehicle to carry you to that place, so some people will lose their baby or they will lose their lives. But now, this health center has brought many things to us because it serves, it's nearer to the villagers and it's very, very cheaper.
The community people are beginning to appreciate the government. They are beginning to appreciate this project. It's making more impact, of course. When the project delivery is faster, when the completion rates are faster, it begins to make more impact.
In southeast Nigeria, there is a marked appreciation for the debt relief gains-funded health sector interventions, which have brought much-needed medical aid to about 20 communities. The monitoring and evaluation teams are preparing more reports on how the MDGs are being pursued in more communities.
Nobody comes around to specifically supervise the quality of the materials, because we have the SPCs, the state project consultants, that need to be at least be advising technically. So for the fact that we are also technically inclined as well on M&E, we also come in to do the job.
We're committed to preparing reports, on how we are achieving this MDG. And of course, we have 8, main goals, and then you have 18 socio-economic indicators. So this data will help us to, measure how these indicators, are ranking in terms of achieving the MDGs.
The monitoring and evaluation teams are encountering particular problems on the field because of the nature of the projects and the bureaucracy.
There's a kind of disconnect between the federal MDAs and the state MDAs. Now, most of the projects that are implemented by the federal MDAs were done without integration of the state relevant MDAs.
The major challenge was trying to get a monitoring and evaluation team into the field following the progress of the work. And there were always, when you're handling thousands of projects, no one project starts at the same time as another. So the post-mortem nature of what has happened, which is that we have to come after the event, has been a big challenge. So we're trying to find a better way of making sure that there's less of a gap between when a project is being implemented and then being monitored.
The MDG's office has recorded improvement in terms of project delivery as a result of continuous monitoring, but the office is aiming for more.
We have been able to sensitize the people that this is not government as usual. Government is now interested in monitoring, not just monitoring their projects where they put their money, but to bring in independent monitors.
There's still a lot to do in terms of the quality, but I think that in itself is an issue that we have in the industry, contractors and consultants, and the sort of the laissez-faire attitude towards government projects that has to change in terms of people's responsibility to contracts.
So far, almost 95% of new primary healthcare centers are ongoing or completed across the country. The challenges and shortcomings are ignored when the impact is being measured. For Chidima, who got to a hospital closer to home, and the people of Okulaga, who now avoid the tedious journey to seek water, MDG's debt relief gains have brought the government closer.